everybody, it's Elisa, and sorry I ended that last video a little abruptly. I kind of went overtime on that. So this is part 9. So these are just some of the red blood cell disorders. It's the short, fast and dirty version of just some of the basic ones to know or just have a heads up on, especially before you hit the patho classes. Okay, so let's go ahead and get started. So let's just talk a few minutes about erythrocyte disorder. So polycytemia means you have too many red blood cells, and that could happen a few different ways because you made too many, or because you don't have enough, like water. But primarily it's, we're looking at polycytemia vera, which means you made too many. And there can also be cancer of erythropoietic cell lines, so they're just constantly overproducing red blood cell, not usually really super functional red blood cells in the bone marrow itself. Some of them can get really high as 1 million RBCs per microliter, with the hematocrit being like 80%. So if here's the hematocrit, then RBCs are like, I mean, it's major, right? And that is an extreme form, but it's, a very simple test to be able to take a look at. Secondary polycythemia is the one that we were talking about that includes dehydration, or also because you had a really quick shift in altitude or overall health, right? Whether it's because you started working out or because you started, getting emphysema. And so this will get us up to about 8 million RBCs per microliter until some other physiological changes can kind of take place in the case that it's like, something that's relatively the body's designed to kind of handle and adapt to. The dangers of polycythemia means there's can be too much blood, but really it means the blood is so thick. It's like tar, and this is like clot city stroke. The heart can't, it's can overproduce, or overstress the heart. You can lead to embolism, right? So distortion and then of the blood vessels themselves. Um, Aneurysm, clots, so not good stuff. Anemia is another one. So there's a couple of categories for that. So one's from bleeding, hemorrhagic anemia from bleeding. So whether this is menorrhagia, this is an actual wound, so internal bleeding, external bleeding. Hemolytic anemias mean red blood cell destruction. And there's a few ways that can happen. And this also includes things like microbes, for example. Malaria is definitely one of the causes of hemolytic anemia. Inadequate erythropoiesis, so we're just not making new replacement cells, or we're just not making enough hemoglobin to put in them. Also, kidney failure can be one of the reasons we're not making enough, because we're not making enough erythropoietin, right? Remember. Iron deficiency, we just aren't consuming enough bioavailable iron in the diet. Pernicious anemia. So this is an autoimmune type attack, and this also violates the ability of the body to absorb enough vitamin B12, or sometimes there's just not enough bioavailable vitamin B12 that's being consumed generally. Hypoplastic means that we're just like slowing erythropoiesis down. And so also aplastic means that we're not making any new red blood cells. So hypo means low, right? So plasticity, right, refers to the ability of these cells to change from a stem cell into a red blood cell. And then A meaning like known, stop, cessation, opposite of plasticity, meaning, that's why it's not happening at all. Okay. Anemia has 3 potential consequences, right? So hypoxia, meaning we're not getting oxygen to tissues, which means the tissues will die and necrotize, right? This is necrosis. Signs being patient's lethargic, sorry, the patient is lethargic. Shortness of breath, it's sometimes upon exertion, sometimes not, just generally. Necrosis of the brain or the heart, kidneys, major organs, organ failure. Reduced blood osmolarity, since it's going to be dealing with ion exchanges. Tissue edema is usually one of the signs that we're starting to see as well. Low blood viscosity means that we're, the heart's going to start racing as the pressure drops. Cardiac heart failure may also happen after that. So blood is like very thin, right? Very, very thin. So the heart's like just racing to try to push water around. Sickle cell disease, sickle cell anemia, right? So the crescent, right? Um, Sickle shaped cell. So normally we have this like donut shape, and so these are not very efficient oxygen transporters. And then also, if they start getting kind of caught on each other, the sickle cells, so they cause clotting. So it's interesting because there's a recessive cell that makes the sickle cell disorder. So you can have people who have both, right? So you can have sickle cell and some normal cells. Um, and we have a high percentage, not a high, but like an unusually higher percentage of individuals from areas that have lots of mosquitoes that carry malaria because it was semi-adaptive to help people survive malarial outbreaks because the parasite for malaria has to use a regular shaped blood cell to reproduce, but can't use the sickle shape. So it can kind of, after they've lysed all of the regular red blood cells, the individuals can sometimes survive long enough on these sickle cell shapes, although anemic, but survive until the malarial parasites all die out. And that's kind of an interesting thing. Unfortunately, it can lead to kidney and heart failure, stroke, joint pain, paralysis, and only again, those heterozygotes can be resistant to malaria because they have the ability to make both, right? So that's kind of it. Here's that sickle cell, this canonical picture. You see this in like every textbook, right? So, all right, so next we're going to talk about red blood cells. So that'll be the next video. I hope you enjoyed our little talk about red blood cell production, erythrocyte production, and all right. Well, I hope you're having a wonderful day. Goodbye.